Welcome, Kortney West. I'm so excited for your presentation because I think there's so many things that anybody who is listening today can take for their own life, identifying things that we can change in our daily life to really help with creating a better outcome. And so I'm very excited to introduce Kortney West, who is a pediatrician and who will be speaking about the underlying medical causes of autism symptoms and how we can think about it and how to approach that topic. So the stage is yours. Welcome, Kortney West.
Thank you. Thank you so much for having me. I'm really excited to share what I have been working on and learning over the last decade and a half of my career. So a little bit more about me. As she said, I'm a pediatrician, a general pediatrician. This is me over on the left side whenever I was 6 with my younger sister. I was a bit of a quirky kid. Didn't really talk very much, was very shy, and had lots of sensory issues, had to cut all the seams out of my socks. Mom would remind me of how much I would annoy her with homework. I had to erase everything until everything was quite perfect. Around the same time, House of Cards came out, which I don't know if any of you seen. Is a really old movie, but it details a little girl who was diagnosed with autism, and that immediately piqued my interest in autism. I don't know if it's because I identified a little bit with some of the symptoms, but obviously not a ton. So anyway, I decided then that I was going to dedicate my career to working in some capacity in the autism field. And that led to me going to medical school to become a pediatrician, where, as you can see here, I'm with a patient still being a little quirky. And then I worked in a couple of different practices and was really seeing a lot of autistic patients. I have been trained to diagnose autism, and so really felt like I wasn't doing what I wanted to in terms of really treating patients in a very precise manner. So that's what led me to opening Precise Pediatrics, where I currently see a lot of kids, some on the spectrum, some not on the spectrum, but those, kids that have a lot of autistic features, like, they come in with anxiety and ADHD, and they also have sensory issues, but they're pretty good socially. And so that's kind of where I've gotten into my little niche and what I see a lot of. So I'm going to quote Dr. Stephen Shore, who spoke to us yesterday. If you've met one person with autism, then you've met one person with autism. So we all know, working with the autism community, that every presentation is different, right? This is a visualization from another article that shows that, being on the spectrum is not as simple as being on a linear line. It's not, you're either low on one side or high on the other. There's this wheel of lots of different symptoms, from motor skills to language and communication and nonverbal communication, executive function, your perception and sensory, and everybody has different features that make their diagnosis and their symptom presentation very unique. So as a reminder, we have, the DSM-5 criteria for autism is in 2 main domains. You have your social communication and impairments. And whenever I am talking to my families, a lot of times I think we get hung up on a label, which is definitely helpful in a lot of scenarios. But really what I'm trying to focus on is, what is the problem, or what is causing distress in that person's life, and how can we help improve their lived experience, right? So whenever I'm thinking about it, you can have anxiety, and that can cause problems with nonverbal communication and your relationships and being able to have social emotional reciprocity. You can have ADHD and have those same problems because you're impulsive and feel like people are not responding to you because you're butting in, or you're not listening to them. And so that can cause social issues. Then you have your restricted and repetitive behaviors and interests, right, which are very common in kids who have autism. But this is also seen in kids who have obsessive compulsive disorder, right? They're very rigid. They would need things very same. They do repetitive movements. And then there's, PANDS, which is pediatric autoimmune neuropsychiatric syndrome, which has a lot of these issues as well, with sensory issues. And all of these kind of overlap and have features of each other. And that's where, I kind of put ASD in the middle of this. So the reason that I'm, kind of breaking it up like that is because looking at the etiology or the cause of autism is really quite complex. It's very multifactorial, right? So I found this diagram, which I really liked, another Venn diagram, because there's just so much overlap. This is a paper where it has ASD again in the middle, but then you have your genes contributing, you have your immune system contributing, and you have your environmental factors contributing. So I'm going to kind of break these up and go one by one. And just to answer Megan, yes, it is similar to PANDAS. PANDAS is just due to strep, and then PANS is the kind of other term. So it's like PANS, PANDAS tend to go along together. So in terms of genetics, we have epigenetics, which I'm going to talk about in just a minute. And then you have your, major syndromes. So Rett syndrome and Fragile X, many have heard of or are commonly associated with autism. Then you have individual genes that are associated with autism. Like SHANK3 deletion is associated with Phelan-McDermid syndrome. So this causes about 1% of autism cases. But you can have SHANK3 changes in that gene that's not completely deleted, but then have some resulting autism symptoms from that. And then we have genomics, which is basically the study of all of your genes interacting with each other. So you can have genes regarding the SHANK3 gene, for example, but then we can also have genes regarding toxin reduction and detoxification pathways, as well as inflammation pathways. So hopefully, as we continue, this will kind of make more sense. Again, it's a very broad and difficult topic, so I'm trying to distill it as much as possible. So I'm just going to kind of review some of the major publications that have come out in the last several years. So this one is out of Italy and is basically an overview of the main genetic, epigenetic, and environmental factors. So I just like to quote this because it shows that it's not just one thing, right? Epigenetics, like we talked about, is basically the study of all factors that affect DNA expression. In other words, your environment. Yes, I will speak slower, sorry. So for your DNA, we all have the same basic makeup that is individual to us. That doesn't change. However, your environment can induce changes that affect how your genes are expressed. In other words, what proteins are produced and when. And that is really comes down to your environment. So this is why, you can have different conditions that are studied in twin studies. So twins are not, they have the same DNA, but they don't have the same environment 100% of the time. So that's why sometimes you'll have differences in the expression of different disease states whenever you look at twin studies. So moving along to our next component, we're going to look at the environment. So there's a couple of different factors here. You have toxins, first of all, then you have infections, and then you have your microbiome, which is implicated more and more in not only autism, but other psychiatric disorders, and your diet, which in turn impacts your microbiome, that then kind of backpedals and impacts your infections and then toxin exposure. So again, it's very circular and all related. So this is a article titled "The Role of Mycotoxins in the Pathobiology of Autism." So looking at the first source of evidence that mycotoxins may contribute to autism in some kids. And then here in 2020 is another study showing that there are changes that are pretty consistent in the gut microbiota of children who have autism spectrum disorder. So we're seeing the same types of patterns in the kids' microbiomes that are living inside their gut when compared with neurotypical peers. And then finally, another paper showing oxidative stress and immune system dysfunction in autism spectrum disorders. So to reiterate the circle, you have your environmental toxins, which then relate to oxidative stress. Your environmental toxins also cause your genetic and genomic expression differences. Both of these things can then relate to immune dysfunction. So that brings us to the last little piece of this puzzle, the immune system. And as you can see here, there's a couple of different categories. So really, in essence, all it boils down to is autoimmunity and neuroinflammation. And both of these have an underlying genetic predisposition to them. Um, Here's an example of a paper that shows that there are autoantibodies to folate receptors that can lead to autism spectrum disorder. And then there's another paper here showing a subtype of autism related to maternal autoantibodies. So a person who has autism related to maternal autoantibodies is probably going to have a different phenotypic expression and different autism symptoms than a patient who has folate receptor autoantibodies. Another paper showing imbalance in pro-inflammatory and anti-inflammatory cytokines in kids with autism, and as well as cytokine dysregulation. So cytokine is your basically inflammatory cascade. So if you get an infection like COVID, then you can get what's called a cytokine storm, and that causes a bunch of inflammation in your body, which is good in infections and trying to fight off things, because that's how our body naturally fights off infections. But if it's out of balance and dysregulated, then it can cause excess inflammation. Looking at the top left corner, basically we kind of just have a single pot that we throw everything into. Since we've categorized all different autism spectrum disorders under one large spectrum, it's hard to sort of parse out. So basically the preferred treatments are behavioral therapies. So everybody who gets an autism diagnosis gets behavioral therapies, which are very important and will always be important no matter what the cause. But that doesn't allow us to really distill down what else we could potentially do to improve that person's symptoms. And then we have, psychotropic medications, which are used for these other comorbid conditions that overlap, right? Like anxiety and SSRIs and ADHD and stimulants. But if you really try and look at the individual cause and see what else is going on, then we may be able to support that in a different way. For example, for autoimmunity and autoantibodies, so there have been studies for those patients that have folate receptor autoantibodies that if basically what that means is that their brain is attacking the transporter to get folate into the brain cells. Okay. So if you give really high doses of folinic acid or leucovorin, then that can bypass that autoimmunity piece and get the folinic acid where it needs to be, and they can have better symptoms and improve symptoms. If you have maternal immune activation or you have autoantibodies, then we can think about immunomodulation. So this would be like IVIG or new biologic medications that sort of tamper down the immune system. Same for cytokines. Remember those pro-inflammatory states. We can try and treat with anti-inflammatories. But you wouldn't just want to throw anti-inflammatories at a child if you don't know that their neuroinflammation is going on. Then we move on over to the left and we have toxin exposures. Obviously, if you have a genetic predisposition to not being able to detoxify, then you're going to want to avoid toxin exposures. There are some people that have more issues with glyphosate than other people. So that it would be even more important for them to avoid exposure to pesticides. Infections can also be a problem in the microbiome. And so we can treat infections, and sometimes that is enough to improve some autism symptoms. And then there have even been studies that fecal microbiota transplants have significantly improved not only GI symptoms associated with autism, but also behavior and social interactions. Those are not approved yet, but the research is pretty promising. So if you can identify microbiome changes that are consistent with other kids that have autism, then we can really target that as a potential therapy. And then diet is another one, right? So if you look at, there's a review of the gluten-free, casein-free diet, which has kind of been hotly debated for a while. Which makes sense, because if we're studying all autism in one and we're giving everybody a gluten-free, casein-free diet, probably only some of those kids who have a sensitivity to gluten are going to respond to the gluten-free, casein-free diet. But there is evidence showing that it works in a subset of these patients. So it's worth trying to figure out if that's a potential thing that could help your child. Here's just an excerpt from a paper that shows the different probiotics. I'm a really big microbiome enthusiast because I think the research and data coming out is super exciting and interesting. But here you can see each of the different types of your typical or good bacteria, your probiotics, and what neurotransmitters they affect. So if you have bacillus, then it affects your serotonin production. That's what 5-HT is. And if you look over here, bifidobacterium, super important for GABA regulation. And GABA is the calming neurotransmitter that balances the glutamate, which is excitatory. And so if you have a deficiency of this, it's been associated with autism and ADHD, as well as some other psychiatric symptoms like depression, anxiety. I just think that's interesting, so that's why I included it here. And then finally, I wanted to leave you with a little case study to kind of give an example. So this is a 4-year-old male who happens to be quirky, like his mother. That's my son. Has a history of asthma, eczema, some GI complaints, was very typically developing until about age 2.5, 3. Then we started to see some sensory sensitivities, lots of lining up of toys. He's very hyperverbal, very social, hypersensitive to stimuli. So like loud noises covering his ears. He's super hyperactive, loves to spin, flinging himself all over, very sensory seeking. He had developed some extreme separation anxiety, also had rigidity and some insistence on sameness. So we had been, doing some occupational therapy and working on all of, behavioral interventions. And then he was hospitalized for hypoglycemia. All the lab work was reassuring, and it was diagnosed as idiopathic. Now, if you don't know what idiopathic means, it's basically the word for doctors saying, we don't know why it's causing this. So I didn't like that answer. So I started looking out to see what other things could be going on here. So whenever you have hypoglycemia, sometimes that is an indicator that your mitochondria are not functioning well. And mitochondria have been highly studied in autism genetics, and we know that mitochondrial dysfunction is a big contributor to autism symptoms. So that's one genetic thing that we had to sort of parse out. And then, with all his GI issues, I started looking into his microbiome. And so we started changing his diet and what he was eating. It turns out he had some Clostridia overgrowth. So we treated that infection, and symptoms started to, get better. But he still wasn't quite, getting back to better. He was still having these hypoglycemic episodes. His rashes were still flaring and everything. And that's whenever I learned about molds. and mold toxicity. And we found a huge, horrible mold infestation in the wall of his bedroom. And um, since removing him from that environment, his, systemic symptoms have all but resolved. The rash has been there. Um, he doesn't have asthma. He still has some hypoglycemic events. We are working on that. We found out that he has celiac disease. So obviously there's another immune component to it that we have to work on. And we know that gluten, especially if you can't tolerate it, is very pro-inflammatory. So that then contributes to neuroinflammation. So basically, it's clear as mud. It's not a straightforward path, and I hope that through this talk I was able to illustrate that there is a lot of different things that can affect what's going on with a child or with a person with autism. And while we may not we're not looking for a cure again, right? What I'm trying to do is identify these symptoms and what could be potentially causing them and how we can potentially intervene to help those symptoms improve. So really, it's not that complicated, right? Um, I have a question here. Can a person be autistic completely without genetic reasons, even without a genetic disposition? Um, that is an interesting question. So I think that our genes are we don't know everything about our genes, right? But there's always going to be some sort of genetic predisposition to have something. So there's so many different genes involved in all of these things, not necessarily autism, right? But you can have genes that contribute to neuroinflammation, or you can have genes that contribute to an inability to detox. And those can then potentially be the causes of autism, if that makes sense. I know it's a bit experimental. Do I have experience utilizing peptides to improve gut health? Are those with autism? No, I do not. I'm not familiar with it. I'd have to look at it. However, do know that gut health is a very important piece of the puzzle, particularly from a neuroinflammation standpoint. So if you have leaky gut, that's going to allow different molecules to cross into your bloodstream that your immune system is then going to identify as foreign. So it's then going to react and cause that inflammation, which then can cross the brain and cause the symptoms of, you know, anxiety, etc. Do I have information on the recent research that suggests that autism is underdiagnosed in women and typically presents differently in women? I, I've looked at this before and I think it's very interesting. I definitely think that it does present a bit differently in women. I do think it's probably also underdiagnosed. I think the last time I read, there was a paper that sort of aligned with that. I don't know if you had like anything in particular about it, but that you wanted me to answer, but I do think that that is actually the case based on what I've read. Do I have insight into the preferred language for people with autism within the autism community? Um, so the people that I've talked to is it's kind of what my understanding, and if I am incorrect, please educate me, is that you can, it depends on the person, right? Just like everything. So I think that there are some people in the autism community who like to be called autistic. I think there are other people who like them to say this person is a child with autism. In terms of high functioning and low functioning, I think that, I try not to use that language other than when referring to what other people have previously categorized people as. So more, not whenever I'm talking to a person saying that they have high functioning autism, but just in terms of referring to like this, in the past, it was referred to as high functioning autism.
Kortney, thank you so much for all the answers, first of all, and for your great presentations. It was a super interesting, and we are so proud and happy that you are part of this summit. Thank you so much again, Kortney.
Yeah, absolutely. I'm happy to share and join you.
Great. For the rest of the audience, we will have our next presentation in around 20 minutes. And now you have finally, I know it's been a packed day, you have finally time to go through the expo and check out the booths. You can see what we offer there, and we'll be back on the main stage in around 20 minutes with an amazing presentation from the Apex social team. So be back in 20 minutes and have fun